Would you give a rat mouth to mouth? Well, neither would I. Dr. Dolittle would. So let's jump into how that goes.
Oh, Doc! Help me. You gotta help me. He's dead. He's laying there dead. You gotta help me. Oh! I'm begging you. Don't let him die.
John?
Hey, Mark, hi.
Where the hell have you been?
Oh, I had an emergency. Excuse me. Sorry.
Oh, hang in there, brother.
So you wouldn't want to be caught sneaking rats into a hospital, would you? They're not particularly the cleanest animals. Certainly our brown rats are wild rats. Now, I think rats are absolutely great pets. And maybe we'll chat about that in a little bit as well. But yeah, I'm not sure it'd be super appropriate.
When I do this?
It ain't no day at the dump.
If he dies, I don't know what I'll do.
You drag me outside and eat me.
Only out of respect.
Yeah, so rats can be cannibals. If they're really hungry, if they're starving, then they absolutely will eat each other. So yeah, that might be true.
Guys, you want to be quiet? I can't hear while you're talking.
Sorry, Doc. John. Uh-oh.
Busted.
He said he was suffering from severe abdominal cramps.
You said?
You know I wouldn't be working on this rat unless it was an emergency. Come take...
I do like the fact that he's got the his magnifiers on, because that's something that I've found, especially as I've got a little bit older, that yeah, I need a good light, and magnification really does help, especially when working on small delicate things. Yeah, like rats, I guess.
Take a look for yourself.
What happened, Doc?
I think he's going to arrest.
What?
I don't feel a pulse.
Oh my God, he's a goner.
Okay, so the rat has just gone into arrest. It was a pretty good death gasp that he did. The first thing Dr. Dolittle did was try and feel for a pulse in his front leg. So you're never going to feel a pulse in the leg of a rat. Now, you absolutely can in a dog and in a cat, but you're never going to feel it in a rat. You're going to feel their heart beating through their chest if you put their fingers over their chest. You know, that's absolutely something that you could feel. Or you're going to get your stethoscope out and have a listen for that heartbeat. So it looks like now he's checking to see if the rat's breathing. So what we do with human CPR, on certainly the courses that I've done, is that you put your face to the person's mouth so that you can feel the breath on their cheek, and at the same time you can also watch their chest for movement. Now again, that's not going to work for a rat. The amount of air that they're pushing in and out of their lungs is absolutely tiny. You're not going to feel it, and if you've got your head there, then you're not going to be able to see their chest, but you are going to be able to tell if they're breathing by watching for their chest or their abdominal, their tummy movement.
He's a goner.
He's not breathing.
He's not breathing.
Johnny. Hey, Mark, maybe we should shock him, huh?
I don't know.
The paddles will be too big. Come on.
Yeah, the paddles are going to be too big. And also, most veterinary clinics are not going to have a defibrillator. So there's a couple of reasons for this. The number of arrests that we get in general clinic and general veterinary practice is absolutely tiny. And then of those, the vast majority of those are something called asystole. So this is the classic when you see a patient, a human in hospital, connected up to an ECG, a heart monitor, and it goes into a flat line. That is asystole, and that is actually not a type of rhythm that you can shock a heart back into normal rhythm, into life. So where you would use a defibrillator is in certain types of fibrillation, so like atrial or ventricular fibrillation. So that's where the heart is kind of contracting and all the electrical activity is all going haywire effectively. But for an asystole, where there's no electrical activity in the heart, then a defibrillator isn't going to work. So that's with the paddles. I don't believe that they come in tiny little rat size. And yeah, there's all kinds of problems there. But the first thing you would do would be chest compressions to try and get that heart going again. So we'll see if he starts doing that now.
You're going to have to give him CPR. You know how to do CPR?
CPR? I can't even spell it. No, I can't even look that.
So you'd start with chest compressions. And yes, you're going to move into giving ventilating the patient, giving breaths, giving them some oxygen, getting some oxygen into their lungs. It's not something that you do in a rat. There's all kinds of, especially a wild rat, there's all kinds of diseases that we can catch from wild rats. So there's things, respiratory diseases, there's certain types of meningitis, rat bite fever. The bubonic plague came from rats, although strictly speaking, it came from the rat fleas that then jumped off and bit people. But there's all kinds of diseases, salmonella, ringworm. You're not going to be you're not going to want to be putting your mouth over that of a rat's. Also, the amount of air that you need to kind of blow in there is so tiny, you're probably going to do more damage than good by overinflating those lungs and causing them to pop. Just by doing chest compressions, by massaging the heart, you're going to be getting air movement into those lungs as well, just through the natural compression and release of the chest, of their thorax.
You didn't even whine him or dine him, Doc. No, Doc. No, I think my friend would rather die. He'd rather die. No tongue, Doc. Eesh.
So he is doing chest compressions at least.
Come on.
Oh, Doc, do something.
I got no pulse.
John.
Lisa, not now. I'm trying to save somebody here.
Honey.
Hey, Lisa, please.
I'm hungry.
It's a false alarm.
A false alarm.
There's nothing wrong with him. He just has gas.
Whoa, you're telling me.
Oh dear. So he might be able to talk to animals, but Dr. Dolittle is not the greatest diagnostician, is he? Like, gas isn't going to present as suddenly going into arrest and then the next minute is absolutely fine and saying you're hungry. So you can absolutely get a buildup of gas because of an intestinal problem, so an intestinal obstruction. So the classic here would be a dog who's eaten a rubber toy or a bone or something that has caused a blockage. That can cause a buildup of gas, which can be very, very painful and ultimately can be and will be fatal, but they're not going to suddenly become a-okay and back to normal as soon as you clear that. There's all kinds of other problems within the body. But hey, at least it's a happy ending for this rat.
He just had gas.
You're back. He's got gas. I don't care if you stink. I love you, pal.
Tell a little buddy, I felt you.
You can check out my other reaction videos linked on screen now, so make sure you click there. But until the next video, I'm Dr. Alex. This is Our Pets Health, because they're family.